So thank you very much, Edward, for the invitation. I'm really happy to be here, and I'm happy to be here, although only part of my research is in neuroaesthetics. Actually, I do a lot of research also on sensory deprivation, so a completely different topic, and on other topics in social cognition. But recently, I became really interested in neuroaesthetics, and so also because I had the privilege to collaborate with Marcos Nadal and with other people here, and so I'm enjoying this line of research very much. So as Marcos pointed out in one of these paper, aesthetic evaluation relies on the very same brain circuits involved in appraising the value of biological relevant objects, depending on one's own state and goals. That is to say, there is no specific neural circuits that is just devoted to the aesthetic experience, but the brain just uses its circuits that uses already for other processes also to experience aesthetic pleasure or aesthetic or beauty. So we know from previous work, mainly from previous neuroimaging work, that all these areas right here are involved in aesthetic appreciation. So what can TMS or TDCS, so what can non-invasive brain simulation add to all these beautiful data obtained from neuroimaging techniques? So for who of you is not familiar with non-invasive brain simulation, these are the two main techniques, so the TMS, transcranial magnetic stimulation, and TDCS, that can be used to modulate the excitability of neural population that you are targeting. They are very nice techniques. I'm using them a lot, but they have also strong limitations. For instance, with TMS, you can just stimulate regions that are on the cortical surface, so you can go a bit deep, but you cannot reach, for instance, the amygdala, so you cannot reach subcortical regions. TDCS is a very nice technique that is also largely used in clinical settings, but the problem is that it's not very focal, so you lose a lot of spatial focality when you want to stimulate a region. And the other, let's say, limit when I talk about neuroaesthetics and I talk about brain stimulation techniques is that you need the participants to give you, to give an answer. So whereas in neuroimaging, you can just look at images without, and no answer may be required, okay? In case of TMS and TDCS, if you want to register to record something, you need to ask participants to give an answer, to express his decision about, for instance, the beauty of the artwork. And as you know, looking at the painting and express explicitly a judgment about whether you like it or not, it's kind of different. So these are the limitations that you have to face when you use brain simulation techniques in this particular context and in other contexts, but still, we can get useful information. So again, just two quick things about TMS and TDCS. With TMS, what you basically do, you use a coil like this. The coil is held over the participant's target area. Here is the vertex, for instance. And what happens is that the current generates a magnetic field that goes into the participant's head, basically, and induces an electric field, and this might interfere with the undergoing neural activity. So usually you might also obtain action potentials. For instance, if you stimulate the motor cortex, you can easily see your finger moving. So you can get this kind of effects. Or if you simulate the visual cortex, you can see phosphines, so this visual qualia, these points of light in your visual field. TDCS is a different technique. You do not induce action potential. You just play with the excitability of the neural population. So basically what you do, you can either increase this excitability or suppress the excitability in a particular region of the brain. This is basically the setup of TDCS stimulator. And there are classical studies that were done here in Germany, in Göttingen. So what Nietzsche and colleagues and Andrea Antal, with whom I collaborate, did was to measure. I'm spending a few words on TDCS first because I'm describing a few studies on this, so I prefer it's clear how it works. So the first studies were done on the motor cortex. This is easy because the motor cortex can be easily measured with motor evoked potential. So what you do, you can modulate the activation of the motor cortex, and then you give a TMS pulse, and you register the motor evoked potential. And basically, if you have inhibited first the cortex with TDCS, the motor evoked potential is weaker. And if you have increases the excitability of the motor cortex, you can observe a stronger motor evoked potential. So what they did was to try anodal and cathodal TDCS, because with TDCS you have two electrodes, where one is the anode and the other is the cathode. And the first studies on the motor cortex found that when you apply basically anodal TDCS, you increases the excitability of the cortex, whereas when you apply cathodal TDCS, you decreases the excitability of the cortex. So now we have a powerful device that we can use to suppress or enhance this activity in a particular region. And so we can play with this to observe changes in behavior. But two more words on TDCS, because very often, I think it's my experience, but if you work in TDCS or in TMS, it's also your experience, you find inconsistent results across different groups, different labs, different studies. Sometimes you don't get anything. I'm looking at Matthew because we had this discussion before. And so it's not that something is wrong with the experiment, but there are many parameters there are many factors that might affect the experiments. For instance, the intensity of stimulation that you're using, 1 milliampere, 2 milliampere, the size of the electrodes, you might have different size. The montage is super important because depending on where you put the electrodes, you may obtain completely different results, the duration of stimulation. And then there is this big issue about individual differences. So Andrea Antal in Göttingen did these wonderful studies showing that there are so many variables, individual variables, that make you more prone to show effects when stimulated with TMS or less prone, so even genetic factors. So all these, when we test a sample of 20 participants, of course, play a role, and this might mask some effects or sometimes enhance some effects. But anyway, this just to give you a picture. Since in previous talks, we also, Marcos, I think, mentioned about neurotransmitters that are important in aesthetic experience, I just want to say that anodal stimulation seems to work by inhibiting GABA, that is an inhibitory neurotransmitter, and cathodal stimulation seems to inhibit glutamate, that is an excitatory neurotransmitters. But TDCS can also alter other neurotransmitters. For instance, it has been found to affect dopamine, the dopamine system, and when we talk about art, and we talk about aesthetic, and we talk about reward, of course, effects on the dopamine systems are important. So just consider that TDCS affects all these. So back to what we can do with the non-invasive brain stimulation to investigate the neural networks involved in aesthetic appreciation. So we started from the lateral prefrontal cortex. So as also Edward mentioned, there are different sectors of the prefrontal cortex that can be involved, that have been found to be involved in aesthetic appreciation. So a consistent finding across the literature, I'm referring to the first Selaconde et al. Studies, but also other groups, was that when participants found something as beautiful, an artwork as beautiful, it was observed an higher activation in the left dorsolateral prefrontal cortex. So our line of reasoning was quite simple. So we decided to increase the excitability of the left dorsolateral prefrontal cortex and to see whether this affected the evaluation of a series of paintings. So this is what we did. So we were able to get the same stimuli that were used by Selaconde and colleagues. So at least we could control for having the same stimuli. And so this is the device we use. And what we did was to apply anodal TDCS. I remind you, anodal enhances cortical excitability on the left dorsolateral prefrontal cortex. And the cathode was here on the supraorbital contralateral region. This is a typical montage. And here above is another study that I did not mention by Kapchik that explained the higher activation in the left dorsolateral prefrontal cortex, saying when you when you evaluate a piece of art, what you are doing is that you are shifting from a pragmatic orientation towards the object to a more aesthetic evaluation. You can also think of this like taking distance from the object. You're not interacting with the object anymore as an object, but you are looking at it as in a contemplation mood. And the dorsolateral prefrontal cortex will be important in this shift that you're doing. So what we did was to, again, apply a nodal TDCS that enhances cortical excitability on the left dorsolateral prefrontal cortex. And after 20 minutes of stimulation, this is also standard, 20 minutes of stimulation, we asked participants to rate the paintings. The same paintings were rated also before stimulation. So participants rated the paintings, received the stimulation, and rating another set of similar paintings again. And the same was done in 2 different days. One day they received real stimulation, and another day sham stimulation. This is an important control, otherwise you don't know what's happening, because, of course, you can also be, there are exposure effects, so maybe you get tired, maybe you refine your criterion, so you get like more generous in your evaluation. So participants evaluated how much they liked the painting using this analogical bar here. And what we found was that when comparing the scores they gave after receiving the stimulation with the scores they gave before receiving stimulation, what we found that was critical was these things here. So basically, participants seemed to like more paintings after receiving a nodal stimulation over the left dorsolateral prefrontal cortex. But this was the case only when they had to evaluate figurative paintings, but not when they were evaluating abstract paintings. So this was kind of unexpected, because it was not easy for us to understand. We are still trying to understand with other experiments why this was the case, and I will tell you a bit more afterwards. But anyway, we found this clear effect, so that another TDCS enhanced liking for representational paintings. And of course, we also did another task. I say of course because when you use TDCS, it's important to have also other tasks, control task. And in this task, we use the same paintings, and we ask a different group of participants to evaluate the color, how colorful the images were. This is important because maybe one can say, okay, the left dorsolateral prefrontal cortex is important for decision making, so maybe another task that asks you to make a decision on a visual features will lead to the same effect. And so we asked for color evaluation, and we did not find any effect. So the results that we got in the first experiment were not related to any kind of visual judgment, but seemed to be related to the aesthetic evaluation. But again, only for representational paintings. And so we thought this was a nice result, but I have to be honest, being in the TDCS, TMS field, so if you look at in PubMed and you look at TDCS over the left dorsolateral prefrontal cortex, you get like thousands, I don't know, tens of papers in which the left dorsolateral prefrontal cortex seems to be involved in other different processes. So I will go back to this. So for instance, I just look for recent papers that came out this year or last year, and you can see that TDCS over the left dorsolateral prefrontal cortex was found to enhance top-down regulation of emotional attention, seems to enhance pain inhibition. Here I'm talking of TDCS in general. I'm not distinguishing between cathodal and anodal, but seems to affect, so when TDCS is given over the left prefrontal cortex, dorsolateral prefrontal cortex, you can have enhanced positive affective experience, you can interfere with language processing, you can reduce craving. Depression, this is one of the most important results, because in clinical settings, you stimulate actually the left dorsolateral prefrontal cortex to reduce depression symptoms. So one may say what you are finding is just a result of a mood change. So you make your mood more positive, you are more positive in evaluating the paintings. TDCS over the left dorsolateral prefrontal cortex modulate risky decision-making, impacts interference processing, and actually I found also these studies by a colleague here that found enhanced mind wandering, if I'm not wrong, using pretty much the same montage we use, because you also did a nodal TDCS over the left dorsolateral prefrontal cortex with the cathode here. So why I'm saying this, not to undermine the validity, hopefully, of my results, but to say that it's not enough to say, okay, with TDCS, I can enhance appreciation. So I think the effort that we should do is to get a bit broader in the perspective and try to understand what are the underlying neurocognitive mechanisms that are responsible for the effect that we are finding. So to say again, is not that aesthetics is something specific, but is part of other mechanisms. And Edward also mentioned the default mode network and mind wandering, and also the associative thinking that I found it very interesting. So I think this is the challenge now for people working with TDCS and TMS in the field. Try to find something that is common to all these studies to get a broader picture. And again, I just go back 1 second to this slide because it connects to what Edward told us before. And it has been shown that applying TDCS over the left dorsolateral prefrontal cortex increase actually functional connectivity in different networks, not just the default mode network, but also the frontoparietal network and the self-referential network. So whenever you are modulating excitability in one node of these networks, due to the spread of the current in the brain, you are also modulating the entire network. And this is something you need to consider when you are interpreting your results. So we found this effect of TDCS in enhancing appreciation of representational paintings. But as you know now, cognitive neuroscience is getting more and more concerned about replication, and I totally agree with this because we have all these studies, and sometimes it's difficult to understand which results are true and which are, they are all true, but you never know if they are really stable over time. So we try to replicate our experiment with a different technique. So we use TMS. So what we did was, again, to present the same set of paintings that we presented in the previous studies, but this time we used TMS. TMS is more focal. So with TMS, you cannot be wrong because you are really targeting a specific brain region. You use a neuronavigation system. You are sure of the region you are targeting. Still, you get just to the surface, to the cortical surface. You cannot go too deep. So what we did in this study was, again, to ask participants to tell us whether they like a painting or not. We asked for a fast decision, because when you're using TMS, you need to be quick in your response, because the TMS effects, when you do online TMS, the effects do not last long. So you need to be very quick in your response. So we asked for a yes-no decision, and then also we asked for a rating, just to have an additional measure. But we were more interested here in the yes-no quick response. So just tell me, do you like it or not? Do you like it or not? And while doing this, participants receive TMS over, again, the dorsolateral prefrontal cortex or over a control site. The vertex is here. Not that there is no brain underneath, but this region is a motor leg-related region, is known not to affect cognitive tasks. That's why the vertex is very often used as a control site in TMS research. So what we found, again, was that interfering with activity in the left dorsolateral prefrontal cortex affected aesthetic judgments. But this time, since before I mentioned that the TDCS effect we reported were just for figurative art and not for abstract art, so this time we had this idea. It was just an insight. We said, well, but it has to do with the type of art itself, or it has to do with the participant's preference for a particular type of art. So when we recruited our participants, we recruited them in order to have a group that prefer figurative art and a group that prefer abstract art. And what we found when testing them with TMS in this experiment was that only people that prefer figurative paintings had an effect of TMS over the dorsolateral prefrontal cortex when judging those paintings. And the same happened for people preferring abstract paintings. So when we simulated their dorsolateral prefrontal cortex, we found an effect only for the type of paintings they preferred. Here you see the number of I like it responses, and you see that basically compared to the vertex, you decrease the appreciation. But this is what you expect with TMS. It's not TDCS, it's TMS. So what you're doing with TMS, you add the noise to the system. So you expect a drop in the performance. So basically, what we found, and the way we interpret our results in these two experiments is that the left dorsolateral prefrontal cortex plays a causal role in aesthetic appreciation. I say causal because with TMS you can basically look at the causal relation between a brain region and a behavior. You cannot do it with the neuroimaging, at least with typical paradigms. Now you have developed more sophisticated paradigms, you can also do it, but neuroimaging is correlational evidence. TMS and TDCS is causal evidence. So brain, you disturb something, you obtain a result. You observe a change in the behavior. So what we found is that the dorsolateral prefrontal cortex is important in aesthetic appreciation, at least when participants have to explicitly give a judgment. This is not trivial. So when participants to give a judgment, and subjective preference matter. So it's not a general effect that you are having with the dorsolateral prefrontal cortex when using TMS and TDCS, but it seems to be related to the kind of artworks that you like. But at the neural level, what does it mean to have a preference? It means that maybe that region is more activated. And so we go into this domain that I have been working in that is more methodological, and I just give you a few ideas about this, a few cues. That is a state dependency of TMS. TMS is like a knife, but it can cut in different ways. Because if you adapt, so one of the typical studies, it's easy if I show you the example. So you know adaptation and priming that are strong behavioral paradigms. So if you adapt participants, for instance, to watch a series of dots that go in one direction, for instance, that go rightward, basically what happens is that when you see, after a minute of adaptation, other dots going rightward, you are worse in detecting the direction of the movement. That's why, because the neurons were adapted, so their activation were suppressed. And so basically you are much faster in detecting dots that go in the opposite direction. So this is a neural adaptation. And with TMS, we have seen that you can reverse it. You can reverse it because when you add, so this is the baseline condition. So when you have adapted to the rightward direction, you are worse in detecting rightward moving dots compared to leftward moving dots. But then when you when you apply TDCS to the motion sensitive region, in this case V5MT, you can reverse the pattern. So it's not important now to go deep into this example. What I want to say is that the effects of TMS depend on the initial activation state of the cortex. So this is important. So if you prefer a particular type of painting, this means that your cortex maybe is more active in that moment for that painting. And so the effects of TMS might depend on the initial activation state of the cortex. I go to the medial prefrontal cortex. I mentioned dorsolateral prefrontal cortex. Let me say something also about the medial prefrontal cortex. So we recently looked into the medial prefrontal cortex because, as you know, many studies, and Edward is one of the authors of these studies, reported activation of the medial prefrontal cortex during aesthetic appreciation. I'm working on the medial prefrontal cortex for my other research in social cognition. So I have done studies in which we have shown that medial prefrontal cortex is important, for instance, in first impression formation. I'm doing this work with Todorov in Princeton. Now we are starting also a collaboration with Van Overwald, that is actually the author of this figure. So here you see all the network that is involved in social cognition. The medial prefrontal cortex is an important node, and as Edward pointed out, there are many sectors of the medial prefrontal cortex that we need to distinguish because they do different things. So for instance, the ventromedial prefrontal cortex seems to be involved in value-based decision-making. The dorsomedial prefrontal cortex is more important in mentalizing. So this morning we learned that the medial prefrontal cortex is important in contextual association processing. There is an overlap, again, with, as Ed showed with us, with the default mode network. So what can we do with the medial prefrontal cortex and non-invasive brain stimulation? So we designed this study in collaboration. This one is with Andrea Antal. So I asked her to model the current flow, because sometimes you see TDCS studies, but now without modelings, but now it's becoming more and more important to provide also a model of the current flow, because otherwise you don't know exactly what you are stimulating. And honestly, when you stimulate, again, with TDCS, you stimulate a lot of regions. So this is our montage. So basically, the anode was put here, and the cathode was put on the vertex. And the regions that seem to be stimulated using this montage, according to the model, is the medial prefrontal cortex, both dorsally and medially, but also sectors of the anterior cingulate cortex. And lateral prefrontal cortex as well got some activation, and the supplementary motor area. So just to tell you how many regions that you can stimulate with this montage. But we were more interested in the dorsomedial prefrontal cortex. So what we did, again, it's kind of the same paradigm that we keep using. So we present paintings, and we ask participants to rate them before and after receiving stimulation. So the study is still in preparation. So we use paintings like these. So if these belonging to one set, this painting belonging to the other set, but they were quite similar. So Marcos did a careful selection of all the stimuli. And what we found, again, was that following real anodal stimulation of the medial prefrontal cortex, we obtain, after receiving, another stimulation of the dorsomedial prefrontal cortex, participants seem to like more the painting. So the same effect of the left dorsolateral prefrontal cortex. So higher beauty ratings. But again, what are the neurocognitive mechanisms underlying this effect? Otherwise, we are just adding another paper to the PubMed list. And I do not have an answer. I'm just putting it on the desk because, again, I was looking for the papers that came out this year and last year on TDCS and the dorsomedial prefrontal cortex. And I found this one showing that stimulating the medial prefrontal cortex affects response selection in a task that has nothing to do with aesthetics. Mind wandering, so this is nice. So so Moshe Bar found with the left dorsolateral prefrontal cortex. My friend Alessio Venanti and this group found an effect on mind wandering, stimulating the dorsomedial prefrontal cortex. So it has been found recently that stimulating, again, with TDCS, the dorsomedial prefrontal cortex enhances also prosocial behavior. So there are many processes that seem to be mediated by the medial prefrontal cortex. So looking at the TDCS literature and the TMS literature, can we figure out some unique neurocognitive mechanism that might be exploited by us when we are engaged in an aesthetic evaluation? So that's the point. Let me mention this. I was forgetting. In this study, they found that the transcranial direct current stimulation of the medial prefrontal cortex affects judgment of moral violation. And I like this study because with Marcos and Camilo Selaconde, we did something similar. So I think you are all familiar with the beautiful is good stereotype, according to which if you think that someone is beautiful, it has to do also with first impression formation. So if you think something is beautiful, somehow you predict erroneously that that person is also more competent, smarter, better, and so on. So interestingly, when you look at the literature, you see that moral evaluation and aesthetic evaluation seem to recruit some common neural circuits. And one of these nodes is the medial prefrontal cortex. So what we did was to test for the beautiful is good stereotype in our participants, applying TMS on the dorsomedial prefrontal cortex. So the experiment was quite easy. So there was a priming word like beautiful, and then participants have to decide about the trustworthiness of a face. This is from the Todorov database. So they have to decide about whether you find this face trustworthy or not. And the behavior that you see under the vertex baseline condition results is that when you, sorry, here the white is not visible. So when evaluation is preceded by an ugly related word, you tend to say that that face is less trustworthy compared to when it's preceded by a beautiful related word. So this is the beautiful is good stereotype. Now, when you stimulate the dorsomedial prefrontal cortex, this effect goes away. When you stimulate the dorsolateral prefrontal cortex, it's still there. So it seems with this experiment, we are providing evidence that the dorsomedial prefrontal cortex is mediating the overlap between aesthetic and ethic moral evaluation. Take moral for trustworthiness evaluation. So how much do you think this person is trustworthy? So aesthetics, these experiments is informative about the fact that aesthetics and ethics are likely to be highly related in the brain, and this might have important implications also for the clinical setting and educational setting. So we spoke about also patients' evidence before, saying, okay, it's difficult to go into patients, but there are patients that have lesions in the dorsomedial prefrontal cortex or hypoactivity in the dorsomedial prefrontal cortex, how this affects their moral judgment, and does this also affect aesthetic experience, for instance. I want to say 2 more words on sensory regions, because the data I presented so far were about the final step. Do I like it or not? So about the decision, so the dorsomedial prefrontal cortex, dorsolateral prefrontal cortex, more about the judgment. But what about sensory regions? So we have evidence, again, from very nice neuroimaging studies that some sensory regions do not just code for the presence of an object or motion or object features like motion, but they also code their value. So basically, they activate more when you find something, an object, more beautiful. This is the case for the motion area MTV5, and this is the case for the lateral occipital complex. So LOC codes for the presence of objects, and it has been found to activate more when you like the object. MTV5 is a response to presence of motion, and has been found to respond more when you when you like more images that contain implied motion. So what we did was to select a series of paintings in which there was implied motion. And again, so we were asking participants to decide about whether the painting was dynamic or not, and in a second block, whether they liked the painting or not. So the idea behind these studies is quite straightforward, we think. So first of all, applying TMS over motion-sensitive region or over the LOC in another study interferes with processing of motion and processing of objects. We should expect a yes, because this is what literature teaches us. But the next step, more interesting, is does this interference affect also the liking of what you're looking at? Okay? So what we did was, in this case, applying TMS to V5MT. So we found that applying TMS over V5MT reduced the perceived motion in the images. But what about the liking? Well, in this case, we found that applying TMS over V5MT reduced liking only for abstract paintings and not for representational paintings. And you might say, why, again, this difference between abstract and figurative? And we discussed it a lot with Marcos, and our idea is that in abstract paintings, some formal features like the motion, colors, play a greater role in driving your aesthetic appreciation, especially if you are a person that has no expertise in art, as our participants. Whereas in case of a figurative art, also the content is important. And so our interference, that is not a dramatic interference. What you do with TMS is just change a bit, maybe 2% or 3%, or you enhance, or you change reaction times of a few milliseconds. So it was able, TMS, only to affect liking of abstract paintings. And I mentioned that we did also a study with the lateral occipital complex. We did the same things again. And in this case, what happened was that we had the opposite compared to V5MT. That is to say that applying TMS over the lateral occipital complex reduced appreciation of figurative paintings, but not of abstract paintings. So I'm giving you just some ideas about how you can use TMS also to play with this distinction, abstract, figurative. And of course, we need to do more, because we found these kind of also counterintuitive results sometimes. And so much work is needed to clarify what are the mechanisms underneath these effects. So in sum, what we can say is that regions involved in object and object features processing are also involved in aesthetic appreciation of visual artworks, but this depends on the kind of image that you're looking at. I am like Edward, so I put too much stuff, but I want to give just one more information, because I like this study very much. It's a study now under review. So we did this study about expressivity in art. So when you look at a piece of art, for instance, a portrait, sometimes you say, oh, I like it because it's very expressive. No? So what is expressivity? Expressivity is related to emotion processing. So what we did with my postdoc was to look at whether the same regions that when you look real physical people are involved in discriminating emotions are also involved when you decide about the expressivity of a portrait, for instance. And the regions here are the superior temporal sulcus, that is a super important region in social cognition because it mediates biological motion detection, is involved in first impression formation, emotion discrimination, mirror neurons for who of you is in the field. And so we simulated the superior temporal sulcus and the somatosensory cortex. Again, mirror neurons, somatosensory cortex. If you see a face, a happy face, you somehow repeat the same things in your somatosensory cortex, and this results in a better comprehension or more immediate comprehension of the emotions. So this is the kind of stimuli we use: faces, portraits, and other non-portraits paintings in which bodies were still visible. And this is the paradigm. So basically, we presented participants with a painting at a time, and they had to say whether they found it expressive or not, and in another block, whether they like it or not. And what we found was that stimulating the superior temporal sulcus reduced the perceived expressivity of paintings without, though, affecting their liking. Again, we are finding sometimes effects only on the perceptual judgments and not on the liking judgment. And again, a lot of stuff that need to be better explained with more experiments. So, in conclusion, brain stimulation might be used to shed light on the contribution to aesthetic appreciation. Of regions involving sensory processing, emotion processing, and decision making. But to make the picture broader, we need to also look at connectivity studies. So TMS and TDCS coupled with fMRI to see what we are really stimulating when we are applying TMS or TDCS to a particular region. We need to link our data to findings in other related domains, so mind wandering, the default mode network, depression, so clinical studies as well. And then this idea of the proactive brain that I find very interesting. And a suggestion, what about the cerebellum? I have a grant now on the cerebellum, on the social cerebellum, because you know that the cerebellum is one of the regions that is involved, that is part of the predictive brain. So we just published a study in which we found that the cerebellum is important in emotion discrimination, for instance. We have another study, not just to advertise myself, but just to tell you what I'm doing. In predictive coding, so there are nice neuroimaging papers suggesting that when you learn a sequence, that is a way in which then you learn to predict series of events, the cerebellum is involved. So I wonder whether some of you maybe also has done some research in cerebellum in neuroaesthetics, because the cerebellum seems to be quite an interesting area to look at when we talk about proactive, predictive brain in neuroaesthetics. That's it. Thank you very much.